My name is Guillermo Durazo Jr., also known as Willie.
So there's a reason that we're talking here today. I'm very eager to hear your story. And this all began Mother's Day 2021.
On Mother's Day 2021, I was asleep, and then I woke up. I had a pain in my chest that I recognized because I have a symptom that I acquired when I was in the military. It's called diverticulitis. And they ran me through some tests, and the doctor finally came back after taking all the tests, and I said, well, you're going to give me the antibiotics? And he indicated, no, we need to do some more testing. Hey, what's the problem? He goes, well, I don't think it's diverticulitis. They took me in, gave me a biopsy, came back, you got cancer. And Dr. Diaz, who was my oncologist, together, and he told me the situation. He says, man, this is very aggressive.
What kind of cancer was it?
It was non-Hodgkin's lymphoma, but I didn't think it was going to happen to me. I said, no, how can it? I don't feel bad. I still couldn't, I comprehend what cancer is, but I didn't see it impacting me. And so I was kind of like in, yeah, you could say maybe a little bit of shock, but I told the doctor, I said, well, what can we do? He says, we can get to work on it right away. I said, let's rock and roll. I had 6 rounds of chemo and 18 rounds of radiation. The chemotherapy, I thought I was going to be getting sick with it. Didn't have a problem at all. And the doctor encouraged me to eat, so all our neighbors, all our friends were bringing me cupcakes and everything else to eat. And when it ended, I said, where's all the cupcakes?
What would you tell those people if they're watching?
God, I love you. And may God bless you. I have one great partner, and she kept me laughing through the whole time.
And you are now cancer-free.
I am cancer-free. I'm so blessed. You know, if you're out there and you're worried about it, there's going to be something or somehow that they're going to help you. Cancer is nothing to be playing around with.
Welcome. And I'll start with this question. Raise your hand if you or someone you know has been affected by cancer. Well, that's most of us, especially among Latinos in South Texas. And that's exactly why we're here today. We're going to discuss why this is happening and also what we can do to treat the growing rates of cancer in our region. I'm very excited for you to be here with us today. We have 3 panelists joining us now to make sense of all of this. We'll start with you, Dr. Amelie Ramirez. You are the Associate Director of Community Outreach and Engagement at the Mays Cancer Center. Dr. Mark Bonin, the Chief Medical Officer at the Mays Cancer Center, and Jeff Flowers, the Chief Executive Officer at UT Health San Antonio's Multi-Specialty and Research Hospital. Thank you for joining us today. And I just mentioned that hospital. We're going to get back to that in just a few minutes because, yes, it's new. So we'll start with you, Dr. Ramirez. We know that cancer is the leading cause of death for Latinos. There are some scary statistics out there. We know that here in South Texas, Latinos experience higher rates of cervical, stomach, and liver cancer compared to other parts of Texas. How do we explain that?
You know, part of it is a number of factors, but one of them is cultural. Our community still fears cancer. They don't want to go see the doctor for fear of being told they might have cancer. So therefore, they're delaying coming in for the appropriate, screenings that they might need. The other is there's a number of what we call social determinants of health that impact their health care. Some of them don't have a physician to see, they don't have the insurance, or even if they have insurance, they're concerned about the copay or can't make time to take off from work to come in. And so all of these are contributing to the delay of diagnosis. And so what we are seeing is that a lot of Latinos are not surviving cancer because they're not coming in early enough. And oftentimes they are diagnosed at stage 4, which means their cancer has metastasized, and that our current treatments, their cancer is so advanced, may not be as effective in treating their cancers.
Yeah, for a lot of them, it's that C word.
Exactly.
They just, once they hear it, everything shuts down, like for many of us. Now, no one ever thinks that this is going to be them. No one ever imagines that they're going to have cancer, yet it does happen. This is why you emphasize screenings.
Exactly, exactly. It's so important. You know, the screenings have become much more simpler to get in. Our insurance is covering sometimes those first screenings that are so important. For example, for cervical cancer, no woman should be dying from that. We have vaccinations, we have screening procedures, and we have treatments. You know, so part of it is just please get yourself in. And we're just doing a lot of work to get our community to understand that that's what makes the difference. Catching that cancer when it's a pin size versus larger makes all the difference in the world.
And for some people, they are concerned about battling their insurance companies because sometimes they think, oh, I don't know if my insurance company is going to cover this treatment, especially screening for cervical cancer, and doctors can also help with that, right?
Yes, and we've got patient navigators that will help and assist you to find out, you know, what your insurance will cover, and if not, what other nonprofits may be out there to help us in getting you covered.
And there are plenty of those around San Antonio. Dr. Bonin, we'll go to you. Do you think that cancer in the Latino community is a crisis?
Yeah, thank you for having us here today, Steph, and letting us talk about what we do. Unfortunately, I really do think it is. You know, for all the reasons that Dr. Ramirez just mentioned, you know, the financial challenges, the cultural challenges of being screened, the access to care challenges that come from the huge geography of South Texas. But then there's a deeper challenge for us, and that is that we don't even understand why some of these cancers are more prevalent in the Latino community.
Right.
And that's because the research hasn't been done. If you look worldwide at our approaches to how we treat cancer, the populations included in those studies generally are not predominantly Latino. And that's why the work that Dr. Ramirez does and the others at Mays Cancer Center are so important, because we're focusing on that community, trying to figure out the very best way to care for that community.
I love that you brought that up, because we are going to get into that a little later on in our discussion, that in order for all of us to know, because we all want to know why this is happening so much to Latinos, we all have to be part of the solution to that and coming up with the answer to that, and that goes to everybody here in the community. So we're going to get into how we can get involved with this in just a few minutes, but okay, I have another question for you here. So we also have the Mays Cancer Center within the UT Health San Antonio. It's been around for 50 years. In the time that you have been CEO, what are some of the challenges that you've seen firsthand that patients and their families encounter when they're dealing with cancer? Because that's very overwhelming.
Yeah. So thanks for asking that. I think, you know, first I like to say at the Mays Cancer Center, we're in the business of helping our patients to have more. More birthdays, more holidays with family, more dinners with friends, more of life's great events. And these things that you mentioned, the challenges that we overcome every day at Mays, are the things that are between them and having more. And so what we do at Mays is we envelope our patients in care. In this, what I mean by that is that we bring the patient in. If a surgeon, a chemotherapy doctor, and a radiation doctor are all going to be involved in that patient's care, they meet them up front. And those doctors work together in what we call a multidisciplinary way to identify the very best treatment for that specific cancer that that specific patient has. And then we envelope them with a team that supports them through the entirety of their care. And we know from the literature that this results in the very best outcomes for cancer patients. What are those challenges? Those challenges are things like, if all your care team isn't in one building, you're going, you know, across town for this doctor, over here for that doctor, over here for the radiation treatment, over there for the infusion treatment. And I'm very proud that we have been able to put all that within the confines of a single building. If you can get to our building, you can partake of all this care, and it'll be coordinated and done in a way that isn't available in many other places.
Well, to the people who are watching this who might be outside of San Antonio, may not be able to access the Mays Cancer Center, what advice would you give them if they find themselves in that situation where they're saying, oh geez, I have to go to this hospital and that doctor, and I don't know if they're communicating with each other? What advice would you give them?
So first and foremost, I'd say, you know, most of my, having done this for many, many years, I can tell you, don't spend more than a day or two panicking. But do spend a day panicking, because that's needed. You need to kind of relieve that that anxiety and stress.
Acknowledge that it's there.
Yeah, exactly. And then make a plan. And that plan needs to include finding the most capable doctors that you can. How do you do that? You talk to friends who've been through the same experience or family members. Then when you do access care, take a friend or family member with you, because having another set of ears is just the best possible plan you can have. Because as the patient, and even from personal experience, I can tell you, when you're the patient, you're not hearing everything that the care team is saying.
Yes.
And it's very technical information, even for healthcare professionals, even when we're outside our field, hearing very technical healthcare information, we don't consume that, digest it, and understand it as well as perhaps we need to. And so having another person there that can really advocate for you and help you. And that's the final thing I'd say, is advocate for yourself. If you think that your doctors aren't talking to each other and that's frustrating you or perhaps compromising your care, demand that they do. Tell them, look, doctor, Dr. Smith over here has been waiting to hear about this report. Can your office please help to get that information to them? And don't be afraid to advocate for yourself.
Right, that's your life.
Yes.
Basically, is in your. It's
Exactly.
it's about staying alive. Now, Jeff, cancer we know is overwhelming. You hear this all the time from patients. There's so much that patients and their families have to take care of when they're going through it. But soon they're going to be able to go to one facility where they can do all of this. Tell us about the multi-specialty and research hospital. That's what I hinted at just a few minutes ago. What makes this place different from every other cancer center?
Yeah, so we start by just tagging on to what Dr. Bonin just talked about. The Mays Cancer Center, they've had the ability to bring everybody together in the multidisciplinary process, but it's all been focused on that outpatient side. The multi-specialty and research hospital gives us the opportunity to collaborate with the Mays Cancer Center and bring that all together under one umbrella as part of UT Health. The research, the clinical trials, the providers that are already in place that do excellent care on the outpatient side, but now we get to bring all that into the inpatient setting and care for our patients and our community across the entire spectrum. I think the big takeaway, if I'm thinking about this from the family and patient's perspective, is what it means for them is they get to stay home, right? There is the option and the opportunity now as we open the multi-specialty and research hospital for you to stay right here and get that comprehensive care, the collaboration between the providers, the outpatient and the inpatient side, and it all come together to work together collaboratively for what's best for the patient and for the family. Having been on that, you asked about raising your hand if you've had somebody that's been affected by it. We all have, right? And at times you've made the decision to leave the community, and the strain that puts on your family and on yourself, having to take off work, having to arrange for childcare, take care of pets, whatever it may be, that's a strain that we will be able to offer an alternative to. And not only offer an alternative where you can stay here, but receive care that is state of the art, matches anything else in the United States in terms of the technology of the facility, but also back to the care provided by our providers, the clinical research and the trials. All of that will be under the umbrella of the UT Health brand as part of the multi-specialty research hospital and the Mays Cancer Center.
There's so much more that we understand now about how cancer affects patients and their families. In a lot of ways, it seems like this new hospital is sort of a reaction to that. One thing that fascinated me is that when this hospital was being developed, you did have input from cancer patients and their families. Could you tell us about that? Because there's no one better than them to say, this is what we need.
Yeah, as they were working through the planning process, they pulled in, and again, because of the relationship with the Mays Cancer Center, we were able to reach out and touch that patient population, get input from them and their families, our providers who care for patients every day in that setting, and get their experience, their preferences, and learn from that and what we developed. I think that gave us an opportunity to create a healing environment. There's a lot of natural light. There's a lot of consideration to not only the patient but the family and how we've designed the building. I think as we open, they'll see that and really enjoy the experience
And I'm really glad that you said that, because often when you speak with patients and they've survived, their battle, they say, oh, but the hospital, it was just so dreary, or it had a weird smell,
Yeah.
or it was really dark in there. So when you mentioned the lighting and all
Yeah.
of these things, that does make a difference mentally.
It does, and there's a lot of research and studies out there around that, and all of that was taken into consideration. We have so many people with so much experience in caring for oncology patients, and all of that was built into what the design of this building and what it looks like. The stem cell unit in particular has a lot of features to it that really took into consideration what the family needs would be
Yes.
in that time. Those patients will be with us for 30 days or more, and that's a long time to be in that facility. And so we tried to take that into consideration in how we designed the building. But going past that, it is the culture that we're trying to create as part of the hospital, the team we're recruiting. It is all designed and built around the idea of creating a hope and healing environment for our patients.
Now, Dr. Bonin, what advice do you have for people who have been newly diagnosed with cancer and don't know how or where to start?
So again, I think finding the most competent, available practitioners you can, and taking the advice of friends and family who've been through the same journey. Again, you can panic up front, but then you've got to get that out of the way and move forward with a definitive plan. Don't delay. You want to get care as fast as you possibly can. If you can come to a place like Mays Cancer Center, we are about to celebrate, as you mentioned, our 50th
Yes.
anniversary as a cancer center. We're having our big celebration in a couple months. We've been an NCI, National Cancer Institute Cancer Center, for over 30 years. That means that we weren't happy with just the status quo, that we reached up and beyond to reach a higher level of care that is recognized by the National Cancer Institute. And then further, not only does that mean we're reaching that higher level of care, it also means that we are researching and developing tomorrow's therapies for the population that we serve. And I think that's a really important part, that we're creating those therapies for the population we serve.
Yeah.
Our population needs that more than any that I'm aware of. And so when you come to Mays, you're enveloped in care. What do I mean by that? I mean, there is a full-on multidisciplinary team that's going to care for you. The interesting thing is that when you are diagnosed with cancer, you don't stop having all of your other health issues that you might have had before.
Right.
So at Mays, we've brought those professionals in to our building. So we have a cardio-oncologist. That's a heart doctor who specializes in patients who have cancer. So if you have a heart issue and you're newly diagnosed with cancer, we have the right person to help support you and get you through your care. We have rehabilitation doctors who specialize in cancer patients. So as you prepare so yes, they're seeing you even before you have any challenge or disability from your cancer or your treatment, and they're doing what we call prehab. They're getting you ready so you'll be as strong as possible, get that running start to get through your therapy. And then they see you on the other side to help mitigate the anything that the cancer might have caused or the treatments, and make you as healthy and capable as possible. We even have a primary care practice within the Mays Cancer Center that helps to take care of patients as they go through care. We know from research that patients who don't see primary care during their cancer treatment journey are more likely to land in the ER and more likely to be admitted to a hospital. And so this is a mitigation strategy we're using to help keep our patients healthy as they go through their care. And then finally, one other way that we implement, that we envelope our patients in care, is we have a survivorship clinic. The survivorship clinic is for when you've finally got across that finish line and you're cancer-free and through with your treatments. We create a plan for you that is all the recommendations that are from the literature that will help keep your cancer from coming back, help keep any other illness from coming in, how to stay happy and healthy and as functional as possible for the rest of your life. And that clinic, that survivorship clinic, follows our patients and over time and keeps them on the right path.
That's essential. I spoke with somebody on staff here who survived colon cancer, and he said one of the things that he dealt with was post-cancer depression. So that you said staying happy and healthy even afterwards, that's also essential. And yes, we are. I can't wait to ask you this next question, but one question, because I'm sure that people are curious at home. They're like, okay, this multi-specialty and research hospital, the Mays Cancer Center, what's the link here? Are these two separate buildings, or these?
Yeah, they are two separate buildings, but they are literally linked. And so we have put a sky bridge in across Floyd Curl that connects us, so our providers, our staff, even patients or family can move back and forth between our two buildings seamlessly in under conditioned space, and so we're interconnected with one another.
Okay, perfect. Now, Dr. Ramirez, you are leading a call to action. The fact is that Latinos tend to be underrepresented in a lot of the studies that we see, and that's why there's so much that we don't understand about why cancer is so prevalent among this group. So you're taking part in a study now to change all of this. It's called the Avanzando Camino study. Tell us about the study, who can join, and what you're trying to accomplish.
Super, thank you. Well, as Dr. Bonin said, we know so little about cancers in Latinos. In fact, there's not been enough research anywhere from prevention through survivorship. And so we are trying to push studies in all of these different areas. But in terms of the survivorship study that you just asked about, that one is the first study of its kind to really focus on Latinos who have had cancer and survived cancer within the last 10 years. And it's a joint study that we're doing with the University of Miami, the Sylvester Cancer Center, and UT Health Mays Cancer Center. Together, we want to recruit 3,000 Latinos so that we can look at the differences among Latinos, because we represent such a wide array of races and ethnicity, from European to Central African to Native American. And so now with precision medicine, we need to have a better understanding of what does our DNA look like, so that the physicians and other researchers can develop better therapies for us. But in this particular study, we want to hear from Latinos who have survived cancer, so they can share their story with us and tell us what was it like, so that in the future we can make things better for them and address many of the things that Dr. Bonin mentioned. How can we get you to exercise more so that we can reduce your risk for perhaps developing a future cancer? Let us know those signs and symptoms that you were dealing with. What are some of the psychosocial issues, emotional issues that you went through? And so we're looking at 8 different cancers. We're looking at breast, prostate, colon, stomach, liver, cervical cancers, and and it's anybody over the age of 18 that can participate. We will follow you for 4 years, and so we'll ask you questions and then ask you to come back in 6 months later. And we have a small incentive. It's not, $50 for every time we visit with you and ask you a lot of questions. But just knowing that you are contributing to future research for you and your loved ones, that's what we need to think about. We've been through this experience, but what can we do differently for the future generations? And that's where we need to learn more.
Right, and you mentioned before that the C word is a very touchy word in a lot of Latino communities, and a lot of communities overall. People don't like to think about how they could potentially pass away. But when you mention this and the importance of this study, I'm thinking that one way to bring people in is think about your children, think about your grandchildren. If this is something that's inherited, that's genetic, maybe what the answers you give or your participation in this study is going to help people in your own family.
Exactly. No, so you're really doing it not only to learn more about yourself. Some of the individuals that have already come through says, you've taken the first time that anybody's asked me about my experience. I haven't even shared it with my family members. They are, so it's a very kind of emotional process that we go along with them, because they have been through a tough journey. But they're so glad to share it, and for those exact reasons. I really, if God said I had to have it, what can I help the future generation to reduce their risk from having a cancer themselves? So they process a lot of this information and really think about how can I make lives better, and that's what we're trying to do here at the Mays Cancer Center.
Now I wonder if you're having more difficulty recruiting men for this study.
Of course,
always. So the men step up.
We have our breast cancer survivors have been amazing. They've been, prostates is not too far behind. The other cancers, what we're finding is that they are in a little bit more delicate condition, so they think twice about wanting to participate in the study. But no, we need everybody. So anybody over the age of 18 we go through a screening procedure, to make sure that they meet all the criteria that we're looking for.
Okay, and if you look on our website right now, well, we also have the link right there. It's the mayscancercenter.org/caminos, and right there you can fill out a form to see if you are eligible, but you can start doing that. And also,
please.
If you watch this, we also have that link in this article on our website. Just scroll down and you'll see it right there so that you could sign up for the study. Now, final question, of course, and good luck. And we want to see you back here in 4 years because I want to know what the outcome is. Don't worry about it, it's not. So Jeff, when is the multi-specialty and research hospital going to open?
Ooh, deep breath. December of this year, so
Okay.
about 60 days.
Okay, wonderful. And everything's on track? Everything's good? You're feeling good?
Everything's on track. We're doing well and we're getting excited.
Okay, wonderful. Well, I think it's perfect for us to leave it right there. Thank you so much for joining us here today. Jeff, Dr. Bon, and Dr. Jimenez, thank you so much for being a part of this conversation. And for all of you at home, thank you so much for watching. Right now on KSAT.com, we have an article with links to all of the places that we mentioned. So if you want to sign up for the cancer study, or if you want to learn more about the new multi-specialty and research hospital, the Mays Cancer Center, all of this is there. And what we want is for you to stay safe and healthy. We'll see you soon.